and I'll leave it to Paul because he got the story, but it is to the Minister for Health and Social Care concerning the patient and the interview that Paul Moulton did. The key thing there is a lot of people are disgusted, to be honest, with the comment, is the word used most in the comments at this situation, that a department that has care in the title puts someone in this situation.
Well, the first thing I need to say, Tim, is it's not the department that makes the decision. It is actually the clinical people looking after the patient. It is not a decision by the department. It is not a decision by politicians or civil servants. It is a decision made by the people in charge of that patient's care. I'm very limited in what I can say in relation to individual cases, but there are always two sides to every story. People will be aware of the new rules that came into effect that made it clear that returning travellers may only self-isolate with another member of the household if that person travelled with them. There is an exemption in law for patient transfers who can have a modified direction notice to be cared for at home where a whole household isolates, and that is based on the requirement for ongoing care in the home based on the person's medical condition. Exemptions are granted based on a clinical assessment of the patient. Clinical assessments are undertaken to reach the decision on whether the person is capable for caring for themselves. Where it's patient transfer concerned, it's actually done twice because it's assessed by the UK team caring for them and also the Isle of Man medical team. So that is an objective test on whether the modification can apply. In this particular case, I can say that both medical teams in the island and also the UK overseeing the care of the patient were of an absolutely unanimous view that an exemption was not required and that the person is fully capable of self-care for the period of isolation. That is the medical view from the medical professionals in charge of that person's care, and it's a unanimous view by both teams. So as I said at the start, it is not for a politician or civil servant to decide if there is a clinical need. That is for the clinicians themselves, and that is exactly the process that has been followed in this case. There have been patients where, due to medical care, they've needed care at home that have been granted the exemption and have gone down the route of the whole household isolating. The clinical team looking after this patient have been absolutely clear, both here in the UK, for this patient that is not required.
Clinical side, yes, but mental health side?
Well, again, the clinicians take everything into account. They take the whole health of the person into account, and that is the clinical view, Tim. In fact, at this point, it would probably be opportune for me to bring in the Director of Public Health to give a bit of a wider piece around why we ask people to isolate away from the home.
Thank you, Minister. Yes, the principle that's involved here is really to prevent mixing, and particularly to prevent mixing between the potentially infected and people who are not potentially infected. And of course, because of the very high infection rates across and the link with hospital-acquired infection, anybody who is travelling back from the UK and anybody who has received care in UK hospitals is clearly regarded as potentially infectious, and hence our self-isolation and testing requirements, which apply to all travellers. And obviously the fairly recent modification to that is that, unlike previously when the rates across were lower, returning travellers are now required to isolate separately and not to return into another household. Now, obviously, it's possible to have individual exceptions to that, and that is based on appropriate assessment of the particular individual case. And that's already been outlined by the Minister. And as he's explained, there is consensus between the clinical teams, both here and across, in this particular case. And therefore, there does not seem to be any grounds to vary this in this case. Thank you.
Thank you. I'll pass the baton on to Paul.
Right, thank you very much, Tim. We now move on to Paul Moulton from Isle of Man Television. Good afternoon, Paul. Fast am I.
Good afternoon, and thank you, Tim Glover, for starting this ball rolling. As you know, over 5,000 people have seen the video. I think your intro today, Chief Minister, saying the government shouldn't be running everything and the family should do more themselves, and you want to pass responsibility back. Therefore, what reason can there be that these two people consensually will sign any forms required? She's now come back negative from a test, by the way, and he says to me today, please do the right thing. He's willing to have any tests, isolate for 3 weeks, whatever. Surely people can take their own responsibility for this sort of thing, and it should never have got to this case to be legislated upon by anybody. And even now it has, isn't this a time for you as a leader to say, you know what, we've made a mistake here. If these people are consensual to isolate themselves, then we'll let them isolate and let them be grown-ups.
Well, Paul, first and foremost, we need to check the full stories here. I'm not convinced you maybe have got the full story. Also, really, it is a case for medics to decide whether or not people should isolate given the infection rate, the current levels of infection rate. Now, of course, if someone is seriously ill, then and our medics are going to say, they need to be looked after. But we also have to remember that a significant number of people who have come back, some of them have sadly been patients who've come back from hospitals and have gone on to infect the family. So based on that, a decision has been made that those patients that don't need the support of a family member, and that's judged by the medics, not by politicians, then it's best that they isolate separately so that they do not potentially pass on the infection to someone else. And really, therefore, it's not up to us as politicians. I would suggest the media too. We should leave it to medics who are eminently qualified to advise whether that person needs to be looked after or not. I don't know, David, if you want to.
Yeah, I will expand on my earlier comments, if I may. The purpose, Paul, of people isolating away from the home as well is, you say initially, by the way, I did mention this, you say her test has come back negative. That'll be the initial return test. And as we know, the initial return test is only expected to pick up 7% of cases. We've got, we don't know for certain someone is not infected until you really reach most people around about day 7 of isolation and then beyond. And there is even that 1% of people who can test negative past day 13. In relation to the patient themselves, it is done as a clinical assessment for that very, very reason, because if they do come back and they infect their household, there is no we do not know for certain what the impact on that household will be. Many people do not get seriously ill with COVID-19, but people do. And that can be household members. We have had cases throughout the pandemic where an index case has gone into a household, the household has been infected, and it is the other person within the household that has become seriously ill and required hospital treatment. So that is one of the reasons that this is in place. It is in place for all travellers returning. So the patient transfer is actually an exemption. We have done many of these exemptions and many that haven't got exemptions. And I've been contacted by people who have had exemptions and people who haven't with the patient transfer, and this is the first one that has come forward and actually said they've had a problem with the process.
And they had to go to the press, which they didn't want to do. And let's face it, it should never have got to the press. Nowhere do I hear you saying anything about, we'll have a look at it, we feel sorry for them, or anything. I think you've lost the room to some degree on this one. Surely, just be the bigger people here and give them, these are 2 adults. Can't they do what they need to do? There's no other people involved. I know we're talking about an individual case, but this does stink that they can't just do what they want to do. And she's clearly asked for help. Now, whatever the medical reasons given, she wants somebody in that house, and therefore surely she should be given that right.
Paul, a very interesting phrase you used there, which is why can't they just do whatever they want to do? If we let everyone pick and choose what they wanted to do, then we would have serious issues. The simple fact is there is processes in place for a reason. With patient transfer, when people go for their patient transfer appointment, they are aware that upon return, they will need to self-isolate alone. I know in this case, obviously, it was classed as emergency care. But there is a clinical assessment behind that, and everything we do with health is based on medical advice. If the clinicians, who ultimately are the people who know about the case, know the details of the case, and know the details of the person, had decided and said this person needs help and support, and even from the mental health point of view, as Tim mentioned, and needs to therefore isolate at home, then the exemption would have been granted. I need to say again, there wasn't even disagreement between the clinical teams in this case. In this case, both the UK and Isle of Man teams on both assessments were absolutely unanimous that the person did not need to be exempted from this self-isolation requirement. Okay. We follow our medical team's advice because it is a clinical decision at the end of the day. I know that the couple aren't happy with it, which is obviously why they have gone to the media, but we do have to follow the rules. The rules are in place for a reason.
Okay, you did say that slightly out of context about saying let them do their own thing. You know what I meant. This is only affecting 2 people. But let's park that. Quickly, this new secondary setup in Douglas. This first I've heard of it. Maybe I've missed it, but it was always going to be the airport. Is this now just another sort of sudden moment to do this, or have you always been planning to have one in the old store in Douglas? And if so, will people pick where they go when they get their turn for the jab?
David.
No, thank you, Chief Minister. No, it will actually be done. It should be done on a geographic basis. The plan initially was to have Newlands still running alongside the airport hub, but since we set up Newlands, obviously things have changed. We've gone into lockdown. We've had to bring restrictions back, including social distancing, and Newlands isn't the best of buildings for doing things like that. So the reason we're looking at transferring Newlands into the old ShopRite building is it's a huge space. As I say, it can be partitioned up very easily because we really need 3 areas. We need a social distanced waiting area for those who are going to receive the vaccine. We need obviously the boothed up, divided up space for people to receive the vaccine. And then we again need a waiting space for those who've had the vaccine who have to wait 15 minutes after their appointment before being discharged. So that gives us the ability to do that with a much greater flow going through than Newlands does with the current restrictions in place. So that we've worked with DOI, and I've got to put on record my thanks to DOI, who've done an excellent job in working on this to ensure that we've got that space.